Hello, my name is Marta. I'm going to be one of your nurses today, and I am here today to help you with your recovery at home due to the stroke. We are going to be going over two important aspects of care going home, which is keeping a safe environment at home and managing medications. After a stroke, usually a person will develop weakness on one side of the body, which then, the patient will have trouble walking or, difficult seeing. And due to those, it's very important that we manage the environment at home and the medications. So some of the things that I would like to provide information on is keeping a safe environment, keep a clear walkway, no loose cords on the floor, no loose rugs, no clutter. For the bathroom, you should use a non-slip mat if you are able to install the grab bars by the toilet and by the shower, and to remind them to use it every time, especially if they're alone. If recommended, a cane or a walker. And also make sure that there is adequate lighting so that the patient can see more clear and are able to, so they are less likely to trip and fall. And also have a plan in place with family members or caregivers. If you can't get to a phone, they do have devices where you wear a bracelet or a chain around your neck with a button, a life alert button. That is very important and should be something that should be considered, so that if you are by yourself and something does happen, they have a fall, they can't get to the phone, at least they can get some sort of emergency help. For the medications, a lot of times, it might be a little difficult to swallow medications, so you have to know which medications you can crush, which medications you're not able to crush, if you can get medications in liquid form. If you're taking any sort of blood thinners, they can cause bleeding. If you have any bruising, unexplained bruising or nosebleeds, it's very important that you notify the doctor. Blood pressure medications, cholesterol, diabetes, if you have diabetes medication. Some tips that we can suggest would be a pill organizer. So you can every week, or you can keep a week pill organizer if you take medications in the AM and the PM. This way it will it'll help you remember to take your medications, or if you forget, you can look at them and say, oh, I didn't take them. You can also set alarms for reminders to take your medication. Always, it's very, very important that you don't stop a medication suddenly, or if you develop any signs and symptoms of an adverse reaction, to always notify the doctor immediately, and always try to keep a list of medications with you at all times. If you have any questions, comments, or concerns, we are always here to help. Please don't hesitate to reach out. If there's any changes, anything that you feel that is not going good or doesn't feel right, you could always, reach our office and speak with the provider. If you feel like it's an emergency, dial 911 so you can go to the hospital. And that's it. Thank you.